Hi everybody. So this is going to be a walkthrough of the Pediatric Airway cart. So in this video, we're going to go through first the contents of the Pediatric Airway cart, drawer by drawer. Next, we're going to talk about the setup for a rigid esophagoscopy and bronchoscopy. And then lastly, we're going to go through some troubleshooting tips that'll help you during the case.
All right, this is version 2.0 of the Peds Airway cart. It lives right now between room 35 and 36 in the Peds OR. And it's mobile. And this is designed, it's intended to be that way. So if you have an emergency in the PICU or the NICU, you should be able to wheel this up there with a light source and do a lot of stuff, help manage airways. So, yeah, so we like to try and keep the top of it clutter-free, okay? We don't want a bunch of stuff stacked up here. On the top, you'll see that we have some tooth guards that are adult size. Those always have to be trimmed for kids. We have anti-fog. We have the Pentax light source that really only works for the Pentax flexible scopes. Don't try and plug a gray cord into this. It doesn't work very well. You would much rather use a light source like this if you're mobile. This is a Tourette. It spins. The gray cords go in this plug-in right here. And it looks different than that because it's got a little nubby right there. Okay? So the gray cord goes right there if you need it. We have that same sort of thing on the video tower. All right. As far as the outside, the other thing that's on the outside are these flexible suctions here. These are the suctions that will go in the side port of the bronchoscopes and the esophagoscopes. They come in 3 sizes, 5 French, 6 French, 7 French. These are actually kept if they're not here. These are urology, ureteral suctions, so they live in the urology area over in the main OR if you ever have to get one. So in the top drawer, we have laryngoscopes. A variety of laryngoscopes. These are in Ziploc bags. These are clean but not sterile. Never reach in here with dirty gloves, okay? So it would be ideal to have some gloves on, but at least make sure your hands are clean. There's nothing in these that are sterile, okay? So we have a variety of different laryngoscopes here. You'll hear the term Benjamin Parson laryngoscopes. That's what these are. I want to show you 2 different types of them. This is the newer type of Benjamin Parsons laryngoscope. You can see that it's got a little air insufflator here. This is actually a Luer lock adapter. And if you want to hook anesthesia into this, you need a 3.0 endotracheal tube adapter will wedge into that. So these come in 3 different lengths, 8 centimeter, 9 centimeter, and 11 centimeter. Unfortunately, they changed the inscription on these. That means nothing. So depending on how old the laryngoscope is, it might have the inscription on there and tell you the length. All right, the older style Benjamin Parsons are over here on the right. These look different because they do not have an air insufflator on them. Okay, but these also come in 8 centimeter, 9 centimeter, and 11 centimeter. These are a little bit nicer for like a neonatal airway because the opening is smaller. So if you're trying to intubate a tiny little preemie up in the NICU, you might like to have this guy rather than this guy just because it's going to get in the mouth a little bit easier. Okay. We also have the next step up would be a 13.5 centimeter laryngoscope. This will get you up to like a decent sized adolescent, maybe not a big adult sized person. So these are a little bit longer. The other laryngoscope you'll want to know about is this little guy right here. This is 11 centimeters long, but this is really nice and skinny. So when I use this, it would be like for intubating a very difficult airway, like a Pierre Robin sort of a kiddo. And if you're ever having to intubate with this, you want to make sure that you intubate Seldinger off of a skinny 0-degree telescope because you don't have a lot of room to work there. So if you're using that for intubation, do a Seldinger intubation off of a rigid scope. The other laryngoscopes that we have back here are Lindholm laryngoscopes. They come in 3 lengths. We have infant, pediatric, and adults. We have light sources and air insufflators for those. We won't complicate things by getting into that in too much detail. Second drawer down, there's two things here. This has a little glass or a little plexiglass thing here. So we have rigid suctions over here. We have light cords, and then we have some graspers over here. So if you just need a grasper, like for putting a pledget in the airway, you can open an entire PEDS OR endoscopy pan, or you can just come over here and get one of these guys. It's the same thing that's on the PEDS OR endoscopy pan. The other thing that is over here are the needle drivers. You can tell it's a needle driver because it has the little ratchet there. All right, third drawer down. These are telescopes, okay? We only keep 0-degree telescopes in this airway cart. We have 30-degree telescopes in the back room over on the other side of room 39. We keep 20 centimeter long and 30 centimeter long telescopes here. Each one of these will have the 4 millimeter and the 2.7 millimeter diameter in there, again 0-degree. And all of these will have a skinny and a fat laryngeal suction in with them. Next drawer down. Double light cord, okay? Can't always trust it. This one's a single light cord, all right? Double light cord. So make sure you read the little instructions there, the little labels, to make sure that you got the right thing. The other thing that's in here are the Pediatric Airway dilators. So these are rigid Jackson laryngeal dilators. You will save lives with these things. So this is usually in this drawer. If it's not here, sometimes it's in the bottom drawer. All right, next drawer down. We have rigid bronchoscopes, rigid esophagoscopes, and bits and pieces, okay? So we have 3 different lengths of rigid bronchoscopes. We have 20 centimeter, we have some 26 centimeter, and then 30 centimeter. They also come in different diameters. So just look on the markings here. It will tell you what you have. This is 30 centimeters long and 4 millimeters in diameter, okay? Mm-hmm. The other thing that we have on here are esophagoscopes. So an esophagoscope looks different than a bronchoscope because the esophagoscope does not have a place to attach a airway onto, okay? Over here you can see that that's got a place to put the anesthesia circuit on. This is a 15 millimeter universal adapter. The esophagoscope does not, because usually we don't ventilate the esophagus. Other than that, the other 3 ports are exactly the same. We'll get into more of those in a little bit. So the esophagoscopes live over here. Just because it's over here, don't assume it's an esophagoscope. Look at the attachments there and make sure that if you pick something off of here, you've got the instrument that you want. The other thing that you'll find in here, this is the laryngeal bovie. That looks a little different, but that's supposed to be a laryngeal bovie, okay? So this is if you needed to cauterize something in the larynx, and then this is the electric cord that goes with it. All right, and then back here are what we call the bits and pieces. These are all the attachments that go in the side port of your bronchoscope. We'll have a little demonstration on how to put those together. Those live back there.
Last drawer.
All right, the last drawer. The last drawer has optical forceps. So this has optical forceps in there. So this would be like your peanut grabbers and your coin grabbers and all of that sort of stuff. Those are 36 centimeters long, and it has a 36 centimeter telescope in with it. It's all in there. The other thing that you'll find here are the optical scissors. So in the rare occasion that you need optical scissors, these are in there separately. There's no telescope in here with this, just the optical scissors. Again, 36 centimeters long. It takes the same telescope that the optical forceps use. So these are some of the trays that we have. These are the telescopes. This is 20 centimeters long, 30 centimeters long, and we have bronchoscopes and the bits and pieces over there. We'll go over those in a little bit more detail here in just a second, okay? So in the telescopes, we have 4 millimeter and 2.7 millimeter diameter. You can see on these that these have a green collar on them. If you see a green collar, it means that it's a 0-degree telescope. If you see a red collar, that means it's 30 degrees. And like I say, normally we have those packaged separately in the back room, okay? Before you use these, you always want to put them up to your eyeball to make sure that they aren't broken. Just make sure you can see through them. You'll see that they come disassembled, right? Can't do anything with this. You need this to screw onto here, and the gray cord screws on there. If you don't have that adapter on there, you can't use the telescope, okay? And then we also have laryngeal suctions. You can see these have got a little soft tip on there. We have a fat and a skinny, right? And we have those on all of the telescope hands. So this is the same thing, but 30 centimeters in length, 0 degree because it's got a green collar there, 4 millimeter diameter, 2.7 millimeter diameter adapters, suctions. So this is the little tray, a little boat, and we call it the bits and pieces for the bronchoscope and the esophagoscopes. I may not have all the names exactly correctly, but I'll tell you what they are. Okay, so critical things. We have a light prism here. The light prism a lot of times is going to be disassembled. Again, you can't do anything with that because the gray cord does not attach. So you need to make sure that you've got the little adapter screwed on there, okay? We have bridges. There are 2 bridges. This is what is going to connect your rigid telescope to your bronchoscope. We have a regular bridge, and then we have an extended bridge, and we'll go over that in just a second, a little bit more, okay? We have a little glass shield, which is goes in the same place on the bronchoscope that this does. We have a little rubber gasket, and you can't use that gasket by itself. It needs to go on this thing. You can see that you've got a little ledge on there, and that just snaps on there, and then that will go in the bronchoscope, and that gives you a way of introducing a telescope into an esophagoscope or a bronchoscope without the use of a bridge. That allows you to move the telescope in and out so you can put the telescope tip exactly where you want. And then the last thing is this little suction port adapter. I want you to notice that this hole is eccentric. It's not in the middle, and more on that in a second. So that snaps on, and then you also want to have one of these little rubber adapters. Most of them will have a little tiny hole in there. This is where you put your flexible suction catheter. If there's not a hole in it already, you can just use an 18 gauge needle and just poke a hole in it. But that goes on there like that. All right, it's game time. This is the most complicated thing we're going to go over today. Okay, so what fits with what? All right, so we have bronchoscopes here, and we have telescopes. You can see that we have 3 different lengths of bronchoscopes. We have 20 centimeter, we have 26 centimeter, and we have 30 centimeter in length. And all of these come in different diameters, but let's just focus on the lengths here, okay? So we have 2 telescopes. We have a 20 centimeter telescope and a 30 centimeter scope. The easy one is this one. 20 centimeter bronchoscope goes with the 20 centimeter telescope, okay? The 30 centimeter telescope matches up very nicely with the 30 centimeter bronchoscope using a normal bridge, but the 26 centimeter telescope needs the extended bridge to be able to use the 30 centimeter telescope.
Because the telescope is too long.
Because the telescope is too long. If you don't use this bridge, this telescope will stick out the end, and you don't want that. Okay? Now, the whole crux of this is getting the bridge on, okay? And we'll go over that last. So whenever you're putting together a bronchoscope, I recommend that you practice, and you practice putting this together on your routine diagnostic cases, and you get really good and very comfortable with it doing diagnostic cases. You want to have this down subconsciously for the cases that require intervention, such as an airway foreign body, okay?
Yep.
So we need to plug all of the holes, okay? I always recommend putting the bronchoscope together, holding it the same way every single time. So I've been doing this for a long time. I always hold the bronchoscope like this, right? So the only thing that goes in this hole is the light prism, okay? You'll notice that there are two positions for this. If you push it all the way into its second click, the light is going down the tube. You will notice sometimes in order to get a flexible suction in here with the telescope, you won't have enough room and you'll need to back this up by one click to make room for your flexible suction, okay? And if you're looking in there and there's no light, it's probably good because that needs to push in another click. All right, so that's the only thing that goes in this port. The only thing that goes on this port is the adapter for your suction. And again, eccentric hole here. So the holes have to line up. So when you put this on, put it on there and then spin it until it clicks. If it doesn't click, you won't be able to get your suction into the bronchoscope, okay? The only thing that goes on here is your ventilator circuit. So you can put a accordion on here, you can put the anesthesia circuit straight on here, you can put a bag valve mask. Anything that sticks onto an endotracheal tube or a trach can go on that right there. It's the only thing that goes there.
You don't need an adapter for that.
You do not. Same for everything. On all of the sizes of the bronchoscopes, that's the same. All right. You can put a variety of different things on this port, okay? You can just put a glass prism on there, right? So when I'm doing an esophagoscopy, you put it in with my naked eyeball, not with a telescope. So that's what you would want to have on there.
Yep.
Okay. The other thing that you can put on there is this little gasket thing that goes on there. And that's what you can use to put a telescope in there if you don't want your telescope in a fixed position. Okay, so that can be helpful, for instance, with rigid esophagoscopy, and you don't want your telescope getting slimed at the end of the esophagoscope. Okay. Or you can put a bridge on there, okay? So I'm going to turn this back to my native position, how I always put it on there. Again, prism over this way, all right? If I have my prism over that way and I'm looking at my bridge, you're going to see that this bridge has two little nubbins. It has a long nubbin and a short nubbin. The long nubbin goes down, points towards the ground. If you're holding your bronchoscope like this.
In the standard position.
In the standard position. If I'm holding the bronchoscope like this is the only way that this is going to snap on there. You can't put it on there any other way. Okay? Now this is the lock for the telescope. Okay? We'll go over that in a second. But this has to go on one nubby parallel with the prism and then one nubby pointing towards the ground. Okay? Now, when you introduce the telescope prism, or the light prism, has to be parallel to this. It's the only way that that's going to go in there, okay? So once you put it in there, then you can lock it, okay? It's the only way it's going to go in there, all right? And if you happen to make a mistake, and this happens to be in the locked position when you put it in there, you're not going to get it all the way in there. So instead of doing all of this sort of stuff, trying to figure out what's going on, just keep it parallel to that. Unlock the bridge, put it all the way in, and then lock it down. All right, now that's the normal sized bridge. All right, the only slight variation is when we are using a 26 centimeter length bronchoscope with a 30 centimeter telescope, in which case we need this is also a bridge, but it's got a little extra length to it to match up the lengths. So you can see that it's got a short nubby and a long nubby. Goes on the same way, okay? One nubby towards the ground, the other nubby straight in line with the prism port there. And again, the telescope goes in just the same way. You lock it down, and that's how that goes. Sometimes you're going to want to have the bridge mounted to the telescope, okay? For instance, if we were doing an airway foreign body and we're putting optical forceps through the bronchoscope, we can't have the bridge on the bronchoscope when we're doing that instrumentation. So the bridge is going to live on your telescope, okay? So the way to put the bridge onto the telescope, again, hold it in your hand the same way with the prism on this side, or just hold it the same way every time in practice, okay? All right, so the bridge, again, when we put it on, one nubby is going to go to the right and one nubby is going to go towards the floor, okay? We're going to put that on there. One nubby parallel with the prism, one nubby towards the ground, and then we can lock it. Do it the same way every single time.
This is a 30 centimeter 0 degree Hopkins rod. It's 4 millimeters in diameter. It's the bigger one in the pan. We've got a double light cord, which has a prism on one end and the regular adapter on the other. For this instance, we're using the Benjamin Parsons laryngoscope. This is an 11 centimeter. We have the adapter for the telescope to the light cord. We have the open adapter, the rubber gasket, and then we have an esophagoscope, which is a 30 centimeter size 4, which the inner and outer diameter measurements are here. We would typically use this is a olive tip laryngeal suction, and then in the endoscopy pan, the pediatric endoscopy pan has the longer open suctions that fit the length of the esophagoscope if you want a rigid suction. Otherwise, there's the flexible suctions on the side of the airway cart. So when I do an esophagoscopy, when I work with you and I like to do an esophagoscopy, you put the prism into the laryngoscope. You can use this to expose your post-cricoid space to be able to insert your esophagoscope more safely. Your esophagoscope, you will use the double open adapter, the rubber gasket. You can put a gasket here. I don't normally for esophagoscopy because you don't need it. You're not trying to have a closed circuit. So use the prism onto the second so that you have light when you take out your telescope. And then we put the adapter on here. Oh, haha, I see. You'll put your camera attached here. You can take that off of there and put it here. So one of the big differences for when I do an esophagoscopy, I think a lot of other folks will put this in with their eyeball. And in a more experienced person who's done this lots of times, that's reasonable. When you're learning, I like to be able to observe everything that you're doing. So I use this rubber gasket and put the telescope here. But then the biggest thing when you do this, your telescope does not extend beyond the tip of the esophagoscope, but in fact on the screen I like to be able to see the entire circumference of the esophagoscope from the inside. And in order to do that, I'll usually hold this like this, so I have control over moving these pieces with this hand and advancing the scope inside of the child's mouth with this hand. So I usually hold this like this.
With the light pointing up, right?
Yes,
everything points up.
All of these point up.
As in to the ceiling.
It can be helpful to have, sometimes all of this ends up weighing a lot, feels heavy in your hands because you're using your tiny intrinsic muscles to keep it all steady. If you have a scrub nurse and they look lost, you can ask them just to hold the weight of these cords. That can be really helpful. In the event that the double light cords are all in decontam, you can use 2 single light cords. A light cord comes in the camera set, so you can use that one and grab another single light cord, and you can plug one in here and then one into a regular headlight box.
So, hopefully that was a helpful demonstration of what is contained in the pediatric airway cart and how things are assembled. There are a few other takeaways from the video that Dr. Kierce and Keel have already touched on. The first one is that, as Dr. Kierce mentioned, it is difficult to get better at handling these instruments without practice and preparation. Overnight, in the vast majority of cases, the OR staff will probably not be familiar with these instruments or even where to find them. For example, the nurse will not know that you will need a longer rigid suction than in the telescope pan and that you will find it in the peds endoscopy pan. Often, the staff will rely on you to help locate and assemble the instruments. So as much practice and preparation you can do in advance, the more comfortable you will feel about the case. And lastly, no video can summarize everything. There is always more learning to do.